Good morning, Sir Rodriguez. I'm Sinead Patrimonio of BSN 1A. So, for today's video, I will be assessing my patient. So, first, I will ask her name. What is her name, Miss?
My name is Jasmine Claire de Pinile.
Okay, so good morning, Miss Pinili. So, for today's assessment, I will assess her head, her face, and her neck. But first, I will sanitize my hand with alcohol. And I will put my gloves on. So for today, I will inspect the size, the shape, and the symmetry of her head. So the size of her face is normal. So the shape of her face is heart shape, and her face is also symmetrical. So I'm gonna inspect her face for her appearance. Her appearance is just very beautiful. The symmetry of her facial features is normal. The lesions, she has a little bit scars, and her hair distribution is uneven because the line of her hair is in the right side of her head. And the movement of her face, so ma'am, can you please smile for me? Thank you. I'm gonna palpate her head for tenderness and massage. So there is no bump on her head. So I'm gonna palpate her face for tenderness and massage. So there is also no bump. And so since I cannot feel irregularities, then it's normal. So since I cannot feel irregularities, then it's normal. I will proceed to the next assessment, which is the neck assessment. So inspect the neck as the client swallows. So first, I will give my client a water. So can you please drink water? So I'm going to inspect the neck in neutral position. Well, it's normal. I didn't see nothing. And I will gonna inspect the neck in hyperextended position. Can you please change it? Okay, I can see nothing. So I'm going to palpate her neck, and I will cover the whole neck in checking for tenderness and muscles. So there's no bump and I can feel nothing. I'm going to palpate her cervical nodes, and so lightly palpates occipital nodes at the base of the skull. Okay, it's normal. So lightly palpates posterior nodes behind the ears. And then the preauricular nodes in front of the ears. Okay, it's normal. So lightly palpates tonsillar nodes at the angle of the jaw. Well, it's normal. And then lightly palpates the mandibular nodes under the mandible. It is also normal. And then lightly palpates submental nodes under the tip of the chin. Well, it's all normal. And then superficial cervical nodes is normal. And then lightly palpates posterior cervical node behind the sternocleidomastoid muscle. It is also normal. And then deeply palpates cervical nodes at the sternocleidomastoid muscle. And then lightly palpates supraclavicular nodes above the clavicle. It is also normal. And then lightly palpates infraclavicular nodes below the clavicle. So it's all normal. So I'm going to palpate her thyroid gland using posterior or anterior approach. So I'm going to locate her thyroid gland below the cricoid cartilage. I'm gonna locate her thyroid gland. So here is her thyroid gland. And then, for the anterior approach, slide fingers to the right to palpate right lobe.
Charger on.
Okay, it's normal. Gently displace trachea to the right. I don't feel any bumps, so it's normal. Then, Miss, can you please swallow? So it's normal. And then, I will slide my fingers from the right to the left. Again, it is also normal. And for the posterior approach, so I will tell my client to place her head at the right side. So, Miss, can you please place your head at the right side? So, can you please swallow, Miss? So, I will palpate her right lobe of the gland. So, I don't feel any bumps, so it's normal. Miss, can you please turn your head to the left? And then, can you please swallow? So it's all normal. So I'm going to auscultate your thyroid gland, but first we need the stethoscope. By auscultating her thyroid gland, we need to use the bell of the stethoscope. So I don't hear any abnormalities in her thyroid gland, so it's all normal. So that's all for the head, face, and neck assessment. After assessing my patient, I'm gonna wash my hands to avoid microorganisms. Since I'm done washing my hands, I'm going to sanitize my hands with alcohol. So that's all for today. Thank you and God bless.